Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How are you?
I'm living it up. I'm always living it up. You know that.
Yes, I do, but I just love to hear you say it. And I think it's good for the audience to hear you say it, too. And speaking of our audience, we want them to also live pain-free and feel like every day they're living it up. So if you have musculoskeletal pain, that's basically orthopedic type pain, which is muscle pain, joint pain, tendon pain. That's a new word. Ligaments and tendons together.
I was wondering what it meant.
Yeah,
I didn't know something.
I wanted to make it interesting for you today. So I just made that up on the spot. Okay, disc pain, back pain, neck pain, knee pain, hip pain, arthritis pain. You might have carpal tunnel syndrome symptoms. You might have tendonitis, stiff joints, dull aches. So if you have any of these, or you think you do, or your family member does, or your friend, call us all hour long here at the studio, 866-870-5752. That's 866-870-5752. That's our number here in the studio. And also, Dr. Darrow has an amazing website chock full of information at www.lastemcells.com. That's www.lastemcells.com. You can email him off of every page on the site and watch him performing the treatments on videos so you can get a visual of what we're talking about today. And we are here Saturdays at 10 a.m., again at 1 p.m. And when you call the program today, here's the best part. You get a free book, Dr. Darrow's latest, called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has actually 264 scientific studies, and it will really give you all the information you need to consider this regenerative treatment. The foreword is written by Suzanne Summers, who's written lots of health books. And you two know each other. I know that. And what else can I tell you? The office. If you've been listening a long time and you just want to call the office, make your appointment, or get very personalized information, call 800-300-9300. That's 800-300-9300. 9300, and that's the office. You can call it 24/7. If someone doesn't answer, they will call you back. And now, that's all I got, unless you want to talk about enthosopathies.
Well, we're definitely going to get to that, but first, I have a joke that someone sent me this morning. It's so cute. So, they said that they brought their new baby son to the pediatrician for his first checkup. And after he finished, the doctor told him, "You have a cute baby." And then the guy said, "I bet you say that to all the new parents." And the doctor says, "No, just to those babies that are really good looking." And so then the man said, "Well, what do you say to the others?" And he said, "He looks just like you."
That's hilarious.
So I'm going to go to a question that just came in actually this morning.
Okay.
And as those who listen to me know, I do emails. I respond to emails all day long. I get emails all day and night long from all over the world. And my website is the portal to getting an email to me. So if you go to www.lastemcells.com, every page has a slot to email me, and I welcome all of your emails. I love talking to new people, and when patients have more questions, they email me. I also give my cell number out to every patient who walks in the door, And they go, God, I've never heard of a doctor doing that before. But I like to stay close in touch with my patients and tell them how cute their babies are. No, I'm just kidding.
All of your patients have cute babies.
Yeah, well, that's right. So anyway, this question just came in. Did I give out the website? It's www.lastemcells.com. www.lastemcells.com. And you can email me from any page on my website. So please do. I'd love to hear from you. I'd rather hear you live and have you call me right now on the radio at 866-870-5752. I'll repeat it while you're grabbing your pencil or a pen. It's 866-870-5752. And give me a call. Let's talk. But a lot of people just email me, and here's one of those. This person's email is labeled failed IT band and knee. So let's see what that means. I have a degenerative horizontal tear in my lateral meniscus along with IT band issues. So let's start like this. What is a tear in the lateral meniscus? The meniscus is a cushion between the bones of the knee from the femur and the tibia, and it allows the cartilage on the end of the bones, the articular cartilage, to slide and move easily. And the person says, along with IT band issues, iliotibial band. That's alongside of the outer portion of the femur, your thigh bone, that goes from the greater trochanter, which is a lump on the side of the bone close to the hip, all the way down to the knee at what's called Gerdy's tubercle. I hope you guys are writing all this stuff down and look it up.
I am.
Good. They say they had 3 regenerative PRP injections with AMG and lipogems. I won't say which doctor does them. No relief, and then had a 10-jet procedure on the IT band with no relief. So, personally, I'm not into the high-level, I'll call them high-level. They're not necessarily high-level, but what people think are high-level procedures that cost a lot of money, because we get the injections done very simply just using PRP or stem cells with the smallest needles. I have patients come in that went somewhere else like this guy did and said it was horrible, it was painful, and most people that come to me go in and out the door without a lot of pain because I try to use the smallest bore needle that can be done, and then we often will spray the area, freeze it, so you don't feel it. And then other procedures done with other doctors. So this guy is a doctor hopper, meaning that they don't get the relief they want, they go to another doctor, which is not the best idea to do. I know these doctors that this guy went to see, I won't mention their names, and they're both top bore doctors. They're very, very good. And so the message here to me and for you is going in looking for a miracle is not the way to do regenerative medicine. You've got to stick with what your doctor tells you, and very often it takes more than one treatment. So then they went to another doctor who said they need stem cell treatment. And what else here? They said it's too expensive to the doctors they went to, can't afford it, and they're looking for a more cost-effective manner. And that's usually why people come to me. I say, why'd you come to me? They say, well, you're the best. You do the most, but I know underneath there is they know I'm the cheapest because my numbers are listed. I start laughing when they tell me all these things. I go, I'm just cheaper, right? And they go, well, I didn't want to say it like that, but yeah. And then some people come in and they go, I didn't want to see you because you're cheap. And I don't trust people that are cheap. Well, I do the most of anybody I've ever heard of, and I can afford to do these procedures in a more reasonable manner than other doctors do, just because of the volume that I do. And I want to be able to do these procedures more than once, because one time sometimes does it, and my wrist was 50% better after one treatment. My shoulder was 100% better after one treatment. I do these procedures on myself, so I know what it's like. I'm the walking testimonial to regenerative medicine. So they go on to say it's extremely hard to know the difference in regenerative medicine doctors. And the answer to that is talk to them. Ask them, how many have you done today? Okay? Put them on the spot. You can ask me. I'm going to tell you. I do this all day long. I basically don't take vacations because I love what I do. I can't wait to get into the office and help people. So I've been told I do the most of anybody on the planet. I don't believe that's true, but maybe it is. I don't know. But I do an awful lot. And this person goes on to say they're 60 years old. They're a mountain cyclist, and they want to get a doc for long-term in a cost-effective manner. Well, I'm probably the guy for that. But call me up. The office number, if you like it, if you want to write it down, is 800-300-9300. I'm going to repeat it for you, 800-300-9300. And you can just Google my name. It's Marc, M-A-R-C, Darrow, D-A-R-R-O-W, M-D. And you'll find, last time I looked on Google, there were about 30 pages about the work I do, about the research we do in the office. We've got 25 students or postgrads trying to get into medical school that we sponsor. And they're all doing research. I'm not a big believer in research, I have to tell you, because the research is only as good as the person doing it, and the research changes from day to day. So I'm not a big believer in that. I'm a big believer in the outcome. The outcome is how many patients does that doctor heal up? And I think we have great results with it. If you want to see our research, give me a call at the office, 800-300-9300, or go to my website and email me. Go to www.lastemcells.com. I know I need to satiate or satisfy the mind of my patients. So that's one of the reasons that I do research, because a lot of people need to see it in writing. I don't believe in it, like I'm saying, but I do it, and it helps these poor students get into medical school by doing research and getting their names on papers. And it's really, really tough to get into medical school now. It is really competitive, and they have what's called a gap year or 2 gap years, where after you graduate from college with straight A's, you're still going to have to do research or work at a doctor's office, work in a hospital before you get accepted to medical school.
Wow,
And,
that's pretty rigorous.
Yeah, it's very, very rigorous, and it's something I feel very bad, because wherever I go and there's medical students working at the doctor's office, I hand out a card and I go, give me a call. Let's get you into medical school. And I've had many, many kids get into medical school because of the work they do at our office. So if you are a medical student or a medical pre-student trying to get in, give me a call. 800-300-9300. I'd love to help you get into medical school. I had a lot of people help me get in, and that was a long time ago. And I even had one doctor who was on the board of admissions who I met who said, give me a call and I will grill you so that when you are at your interview, you'll know how to handle it. And he did. He grilled me. And he beat me up, and when it was time for my interview, I knew what to do. So doctors help people get into medical school because it's an apprentice type of a system, and we like to help each other. So I also have doctors who fly in from all over the world to watch me do procedures so they can go back home and do that on their patients. So, yeah, I love being a doctor, and I love helping people, and I love helping people get into medical school.
Well,
so yes, we can help people with these meniscal tears. We treat knees and meniscal tears all day long, literally, and IT band issues, iliotibial band issues all the time, and get very, very great success with that.
So my turn, I'm going to give a phone number. I know you're in pain because 30 to 40% of Americans are in musculoskeletal pain, so give us a call here at the studio. It's 866-870-5752. That's 866-870-5752. And don't stay in pain one more day without finding out what's going on. I think a lot of people sit around being sort of mystified by their pain, puzzled.
I think so. I think it's true. And different doctors have different ways of dealing with it. The most typical is giving out medication like narcotics and anti-seizure medicines like gabapentin or anti-inflammatories. And when that doesn't work, then they send these patients to the surgeon. And I have way too many people that come in with what are called failed surgeries, things like failed back syndrome. And it's a shame because the surgery was done when it should not have been done. And when regenerative medicine using PRP, platelet-rich plasma, which are just simple process, taking your blood and injecting it, or using stem cells, can heal the area. And I actually do have a question right on this now, which is labeled failed back syndrome debilitating. So I wanted to talk about this. This person writes, I had an L4 through S1 spine fusion with rods and screws more than 2 years ago. Since the surgery, I have been in debilitating pain all over my body, much worse pain than before the surgery. And I hear this story every single day with new patients who come in. And the new pain is all over. The old pain was more isolated. That's common. And what happens often is when someone has a traumatic event, like a surgery, surgeries are very traumatic events, they end up having these fibromyalgia conditions where the neurological system just goes into shock. And then the person says, what kind of tests determine whether I would be a good candidate for stem cell or prolotherapy or PRP? And the test is with my hands. It's not with MRIs, and it's not with X-rays, and it's not with CT scans. I'm not putting those down. I always get them to see if I miss something horrific. I've picked up a few cancers with those type of exams, the MRIs and whatnot. So I do like to get them. But most of the time, I don't need them to treat, but I like to get them just to make sure I'm not missing something. And my tests are done with my fingers, my hands, and moving the person around. That tells me what's going on. And I see this almost every day with new patients with back pain, neck pain. I touch the area, and I can tell where the pain is coming from, and then I can inject and get rid of it. And these people say, well, I can't believe you can get rid of it because I've been to several neurosurgeons and orthopedic surgeons, and they looked at the MRI and they showed it to me, and they have, they've shown me herniated discs and things like that, or arthritis, arthropathies, facet syndromes, and they say I have to get surgery for that. And I say, you do not have to get surgery. I just touched the area and you jumped and you said it hurt. These other things you can't press and hurt. They're deeper inside, and they're pain things that come from nerve issues that do need surgery, but most of the time people come in when you can't touch the pain. And those are the ones that do need surgery, but more often than that are people that come in where I can touch it, and that isn't nerve things. That is just what Nita started off talking about, laughing, enthesopathies. It's where the ligaments and the tendons attach to the bone. And that really is where most of the pain comes from with necks and back. So if you can touch the area and make it hurt, that's not a nerve issue and typically does not need surgery. So this person had failed back syndrome, meaning they had the surgery, they had a fusion, it failed because it wasn't done in the right area. It wasn't the area that was causing the pain. These are the kind of people that we help every day. So they go on to say, are there doctors in New York City who you think can do these therapies well? I never can answer that question. Unless I know the doctor, I can't speak to them. But if you're in New York City and you don't want to fly out here, which I think is a great idea because my prices are cheaper than other doctors anyway, and you can pay for a little vacation while you're here. But if you are in New York City or anywhere else and you can't come to see me, call the doctor up and say, how many of these procedures have you done today? How many did you do yesterday? Find the guy who's done the most. Don't find the guy who does it once in a while, who went to a weekend course and says they're a regenerative medicine doctor. Find someone who does it all day long. I've been doing this stuff 22 years as of now, all day, every day. So I hope that gives you a little bit of freedom to think that there's some safety here. Okay?
Sounds good to me.
You got anything you want me to
Yeah,
grab
I
another
want to
question?
give the phone number again so people know where we are here in the studio at 866-870-5752. That's 866-870-5752.
Excellent. I'd like to also mention that in the office I do the musculoskeletal work, and that means, the tendons, ligaments, joints, arthritis, anywhere really from the back of the head all the way down to the bottom of the feet, every joint along the way and every tendon and ligament along the way. And I don't treat disease, so to speak. I don't consider arthritis a disease. It can be. Things like rheumatoid arthritis I do treat. But I'm not treating multiple sclerosis and, different disease states like that. Yeah, I mean, some autoimmune things I can do, but I don't treat the disease of it other than diet change, getting people on diets that are alkaline, things like that. But you need to go to a rheumatologist and get the medicine for very severe diseases like that. But specific joint issues from autoimmune, yes. There are people that have things like ankylosing spondylitis, and for the specific joints, I can help with that. But I mean, I'm not doing IV things. I don't believe in that at this point, and the FDA is not in favor of it. So I stay away from that. There are people that do it, but the studies on it are not very excellent at this point, so I stay away from it.
Well, speaking of arthritis, we do have Bill calling in about arthritis in his thumb.
Good. Well, I'm going to take him in a minute, Nita,
okay.
But I need to finish up because my wife does do the vampire facelift on the face, which is a simple procedure of taking your platelets or stem cells and injecting the face and growing the collagen back there and making you look young, because the face does dry out just like the rest of the body. We shrink everywhere. And I remember when I was a teenager, I was about 6'1", and now I'm probably about 5'11".
Gosh.
Part of that is sitting at a desk and being humped over all day. But part of it is just the discs in the spine dry out, and we shrink. Humans shrink as they get older. And also we do these procedures on the top of the head for people with hair loss, and the studies show that it works very well. And in my book on stem cell therapy and platelet therapy, Regenerate, Don't Operate, we have a chapter on hair growth on page 126. And the vampire facelift, I don't think you're going to forget that one. We have a chapter on that on page 117. If you call us up, we'll give you a copy of this book for free. So give us a buzz at 866-870-5752. I'm going to repeat it, 866-870-5752. We've got some calls racking up here. I'm going to go to Bill. You've got arthritis in your thumb. We treat those all day long with great success. How long has that bothered you for, Bill?
Probably a couple of years. I've had 3 sets of injections.
Stick with us. We got a break, and
Hold
then
on,
we'll
Bill.
get right to you, and we'll get to Francine and the other callers.
And you're listening to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita.